And when I met Dr. Hepsharat Amadi, when I first met her, there was a quiet power. There is a quiet power within her that really drew me in. And I thought, this woman has her mojo and knows her shit. And so I'm a huge fan of natural healing, right? And I also am a woman who's experienced, as you've heard, early perimenopause and has handled that naturally. And when we first met, you've all had many of you have had a ride on the Beamer machine, yes? Have you been enjoying that? If you haven't, well, you're gonna learn more about it in a moment. So let me introduce Dr. Hep, because I have been talking to her about coming to this event and being a part of this event for about a year now. And I said, look, my women, they're gonna love you, and I know that you're going to love them as well. So I'm so excited that she's here. Dr. Hepsharat Amadi is a holistic family physician who specializes in natural health care using quantum biofeedback, Beamer technology, supplements, herbs, and homeopathic remedies. She approaches treating the whole patient physically, emotionally, and spiritually to optimize their overall health. She specializes in natural hormone replacement therapies, and besides that, her bio is way too long for me to read to you right now. This woman has more degrees, is a medical doctor, understands all spectrums of medicine, and really understands about helping you to support yourselves being the most holistically healthy, empowered women as possible. So please give a warm, mojo-licious welcome to Dr. Hepsharat Amadi! Yeah!
Thank you for the sweet intro.
You are so welcome.
So nice.
You are so welcome. Welcome, my dear. I'm really glad you are here. By the way, Dr. Hep, little feedback. Dr. Hep came all the way from Florida. Oh. I know, all the way from Florida. So we're glad you're here. The stage is yours. Please
Thank you.
Enjoy, everybody.
And I'm so happy to be here, and I see why Deborah so graciously invited me. You're a great and inspiring group of women, and I'm so glad to be here to talk to you. So glad you're still here at the end of a long weekend, but I hope that your patience will be well rewarded. And I just wanted to say that I think it's so important for women to support each other and how one thing leads to another. I belong to the Women's Prosperity Network in Florida, and that's how I met the person whose event I wound up meeting Deborah through. So one thing leads to another, and you really just need to trust the journey. You know, again, our mind wants to focus on the details, and you know, sometimes we hear the little voices saying, but what about this? And I don't know about that. You know, just let your heart be your compass. You know, it's been my compass over time, and there's been many difficulties in the road, but I really want to congratulate all of you, because all of you have decided to really live the most fulfilled life that you can. And you've backed up that decision with action. And I think that's so important, because there's an 80-20 rule. 80% of the people really don't go for it. You know, whether they want to or not, they kind of content themselves with doing what everybody else does and being who everybody else is. But unfortunately, it doesn't really allow them to really be their fullest self. So all of you have decided to be your fullest self, otherwise you wouldn't be here. My fullest self has led a long journey. When I was rather young, I thought that I wanted to become a psychiatrist. So when I told that to people, they said, oh, well, if you want to do that, you have to go to medical school. So I went on the path to go to medical school, and when I got there, I found that you can't really, you know, I found that I was just as interested in physical stuff as mental stuff. And then when I got further down the line, I discovered that you can't have one without the other. Even though this society likes to compartmentalize and say, well, this is a physical thing, and this is a mental thing, and this is a psychological or a spiritual or emotional thing. But really, you know, we're just all one person. And So you can't have physical stuff without mental stuff, you can't have mental stuff without physical stuff, and one of the reasons why I love doing what I do so much is because I work with the quantum biofeedback machine, and this allows me to see all aspects of a person's functioning on an electromagnetic level. And how many here, other than the fact that I just mentioned it, I know one other person in the audience has experienced quantum biofeedback treatment, but just raise your hand if you've even heard of it. Wow. That's why I love California. And that's why I keep coming back here. It's just amazing how open-minded people in California are, and you get it about the energy. You get that energy is matter and matter is energy. So sometimes people ask me, well, how can you tune into somebody who's at a distance? Well, the reason why they might have problems imagining how that could work is because they're still used to thinking of themselves as a physical being that's only in one place at one time. But the laws of quantum physics say that energy is matter and matter is energy. They're just two different forms. So we all have our own unique frequencies and vibrations, just like we all have our own unique DNA. And if one has the proper equipment, one can tune into that, just like tuning into a radio station. All you do is calibrate to that individual on that machine. And the reason why I find that to be so important is because it's helped me discover things about how human beings' minds and bodies work, and also about bioidentical hormones. So let me just ask you this, just for the fun of it. How many of you here have ever been to a doctor for an annual physical? Just a routine annual physical? Well, I would say probably most. And how many people at that annual physical where routine blood work was done without you specifically asking for it, the doctor has gone ahead and measured your cholesterol levels? How many of you have had that experience? Okay, most of you. A lot of you. So how many of you have ever visited a doctor's office for a routine physical, and without your asking them or prompting them in any way, they have measured hormone levels on you?
No one.
No. And yet, hormones are so important. They're so important to how our brain functions, how our heart functions. It's not just about reproduction, but even our bones are affected by our hormonal status, and even other things like inflammation and pain can be affected by our hormonal status. So why aren't they measuring these things? I take bioidentical hormones. I am going to be 62 this year. I've been taking them since I was 48. I wouldn't like to live without them. I don't really consider that a real medication because it's just supplementing the hormones that my body is already making. It just may not be making as much as it was when I was younger. But I don't take any other medications because using the quantum biofeedback machine and now the beamer, I haven't needed to use that. But there's a lot of things that people go through and that they're taking medications for that I believe if their hormones were balanced, they might not have to be taking those meds. And one of the things that gets me very excited and turned on about talking about hormones is because they're so fascinating in that they have mind and body aspects. So for example, when a person's hypothyroid, they may be depressed, or when a person's hypoadrenal, they may feel as though they just can't get up the gumption to do whatever. And yet, these things are almost never measured. So I would say that one of the biggest demographics that I see in my office is, women who are maybe between 40 and 65, let's just say. I see every age from babies to, as old as they come. I've seen the oldest patient was in her 90s, but I would say the largest demographic is certainly women and middle-aged women. And yet, you would think that doctors would be measuring their hormones and giving them the hormones that they need to help balance out their system. And it's really very important because how many here in this room know of somebody who has cancer? It's quite a few. How many of those who raise their hand, how many is it, let's say, breast cancer or uterine cancer or cervical cancer or ovarian cancer? It's quite a few. So one very interesting fact is that all of those type of female reproductive system cancers occur in an environment of too much estrogen for how much progesterone there is. That's one of the reasons why, as we get older, we're more at risk for certain types of cancers than we are when we're younger, because when we're younger, we have more of certain types of hormones, and this is protective. So I don't see the point of waiting until somebody develops something like that, you know, when you can check what their hormonal status is beforehand and actually do something about it, help to balance it. And you know, there's a lot of mythology out there about hormones, and this is partly, I think, from something that was perpetrated on women some time ago, with them handing out Premarin to people, you know, at the drop of a hat. How many, just for the fun of it, who knows the derivation of the word Premarin?
Horse.
There you go. Very erudite audience.
What is
Pregnant mare's urine
Nice.
is where Premarin came from. And did they measure anybody's hormones before they put them on it? No. Did they measure their hormones after they put it on it? No. So, you know, to me, this is really,
Criminal.
it's criminal.
Criminal.
That was the word in my head. You must have been reading my mind. I was trying to, you know, but it is criminal. And, you know, there's so much misinformation that's spread about hormones. For example, the idea that if you have cancer, or if you had a first-degree relative that had cancer, then you're not a candidate for bioidentical hormone replacement.
What?
That is just not true.
No.
As a matter of fact, having the right hormones on board can help prevent you from getting cancer. So if they didn't catch it beforehand, they certainly should be optimizing your hormonal balance, you know, after it's been discovered, and not just, you know, putting you on medications that totally, you know, zap your system and prevent you from being able to utilize the hormones that your body is making. Here's another interesting fact, and I can see my time is running out, and once I start talking about hormones, it's just hard to shut me up. Anyway, how many people know that there's 3 types of estrogen out there? Okay, and how many people knew, well, you're a biochemist, so that doesn't count. No, anyway. Anyway, how many people knew that 2 kinds of those estrogens contribute to increased risk for cancer, and that 1 kind contributes to decreased risk? Yeah, we're not going to count you again. How many people knew that?
Yeah, I heard some.
This is estradiol and estrone are the stronger estrogens. They contribute to more chance.
What's the second one?
Estradiol and estrone.
They're synthetic, right?
No, the body does actually produce them, but it's the ratio that you have them in. See, the more that you have of those 2, higher risk for cancer. The more that you have of estriol, which is the 3rd kind, the lower the risk for cancer. In Europe, they test these things. That test is called fractionated estrogens. They don't do that over here.
Why not?
Well, they should be.
Support the birth
They should
control.
be.
Why would they support
But you know,
hormones?
unfortunately, cancer is a big business.
Yeah, right.
Yeah.
That's just the way it is. But I wanted to share with you this one last thing, because I think it's really important to know. I am working on a book right now about bioidentical hormone replacement therapy, done the way that I think it should be done. If any of you would like to get a free ebook once that comes out, and it should be coming out at least by September, you have a sign-up sheet over by my booth there. Feel welcome to sign up for that. I'd be happy to share that with you. one thing that I found out is that you can do a functional assessment of how well a person's hormones are functioning and what they need to be taking in order to improve their function. And it's not necessarily what they're lowest in lab-wise. And I can do that remotely using the quantum biofeedback machine. Unbelievably enough, but this is how I test my hormones myself, by the quantum biofeedback machine. So I would just like to encourage you on your journey and say that, you know, it's really good to hook up with a group and to hook up with a mentor, because, you know, mentors have been really important to me in my life and in inspiring and encouraging me to go on. And there's, you know, so much of that that's waiting for you. I think it's really important for women especially to be whole and to be healthy and to be nourished, because we take care of the rest of the world. And, you know, the planet really needs us to be whole and healthy so that we can take care of everybody else, and also the planet,
That's
which
right.
needs healing as well.
That's right.
So I don't have much time. If anybody wants to ask one brief question, I might try to squeeze it in. Yes?
What happens with the BRCA gene if someone has that?
You know, here's what I'll say. I'll give you some references real quick. It's not so much about the genes that you have, it's about the expression of the genes. And if you want to find out more about that, read a book by Bruce Lipton called Epigenetics. No, it's called The Biology of Belief, but he talks about epigenetics in there. And in my last few seconds, I'd like to also recommend you another wonderful book that should probably be on your group's reading list. It's written by a heroine of mine. Her name is Candace Pert, and it's called Molecules of Emotion. Fabulous book. She was one of the people who was in the beginning of the movie, What the Bleep Do We Know?
Okay.
And if anybody has trouble understanding, you know, quantum physics as it applies to us and our health, they definitely should watch What the Bleep Do We Know several times, because the first time will probably not be enough to get it. So, her name is Candace, C-A-N-D-A-C-E, Pert, P-E-R-T. And she was one of the trailblazers who blazed a trail in hard science at a time when women were not in hard science.
And the name of the book?
Molecules of Emotion. She actually, her work was the one that established the presence of opioid receptors in the brain. Okay, thank you so much for your attention. If you have any further questions or want to sign up for the ebooks,